but we don't have a system to fight, this ball of silicone that's now been placed into our body. And it's not inert. We used to think that they were inert and that we could stick that in and it wasn't going to do anything. But now we know that with this new evidence that the shells are breaking down, whether it be it silicone or saline, and that the shells are bleeding the silicone through the body. And our immune system doesn't know what to do with silicone. So we get what's called silicone granulomas, which are just chronic inflammation. And so our immune system is just chronically turned on, trying to deal with this silicone, and it can never win that battle. It loses. It can't get rid of the silicone. I do see a lot of patients though that will say, I don't have breast implant illness symptoms, and I'll take out their implants and do it right, do it en bloc or do it total capsulectomy, remove all the capsule. And they'll come back and say, oh, I didn't even realize this symptom. I just noticed that my eyes were clear, or I just noticed I have a lot more energy after removing the implant, or a lot of other things. So to answer your question, I think that it does affect everyone.
Hello, my friends. Welcome back to the Dr. Lowe Show. I'm excited to have my own personal surgeon on the episode today. And I probably would have had him even if I didn't work with him personally, because he's just very accomplished and has a really great specialty that I think you'll find really interesting. And this is a hot topic out in medicine right now. So we have Dr. Jon Bradley Strawn. He's the founder of Sculptura. He's a board certified plastic surgeon. He has extensive experience and expertise. He graduated from Georgetown University in Washington, D.C. with a medical degree, and he completed his plastic and general surgery training at University of California, San Francisco, specializing in breast reconstruction, fat grafting, and wound care, and later moved to Orange County to establish practice with a distinct mission to specialize in the care of patients facing breast reconstruction challenges. So this mission has guided him as he has expanded his expertise to assist patients requiring breast revisions and also reconstruction following implant removal. So yeah, Dr. Strawn, welcome to the show. It's good to have you.
Thank you for inviting me.
Yeah,
I'm excited.
Last time I saw you, I got to be in your practice, and
that's right.
Recording some stuff. So now we get to do it on the flip side.
Yes.
So your expertise is very interesting, because I find that a lot of surgeons mainly do implants and then they'll do some explants. But I know for you, it's more of a specific focus on explants and reconstruction. So I'm curious, like, why you were drawn to that. Why are you a specialist in that particular area?
Right. I never really placed implants. That was never part of my practice. And early on, around 2003, we were starting to learn about fat grafting. And so I saw some results of fat grafting augmentations, and I thought, why would anyone put these foreign objects in their body when you could just do your own fat tissue? So from a long time ago, I've just sort of not been anti-implants, but just, why put implants unless you absolutely have to?
Right. Did you ever do implants much? Did you do
not really cosmetic implants, no.
Okay.
But I did do some implants for reconstruction. So when patients have mastectomies, that is the easiest way to get, restore form and function is to put implants. But we were trying to push the edge of what's called oncoplastic surgery, where we were, instead of just going right to a mastectomy, we were taking larger lumpectomies so we could get rid of the cancer, but then rearranging the tissue and then fat grafting so that we could make nice natural breasts, but also take care of the cancer and avoid the foreign objects, the breast implants.
Right. Well, that's a cool little rabbit trail we could do on the actual cancer portion of that. So let's say a woman is, maybe wanting to do her own self breast exam. I mean, you have seen and I'm sure palpated so much breast cancer in your day, right? So
yeah, some usually they get picked up in screening now. So, by the time they usually they don't get as far advanced as they have in the past. So that's why we're trying to do more oncoplastic, where get these earlier, get the cancers out, get things reconstructed, make them look good, and avoiding the breast implants. Because now we know, the texture breast implants are causing, breast implant associated ALCL, which is a form of cancer. It's a activation of white blood cells. So this isn't breast cancer per se. This is like a lymphoma. So it's your immune system that's chronically irritated by this implant, which is sort of what we're talking about, what we'll get to with breast implant illness, that these foreign objects are activating our immune system, and then that immune system can then go on to cause cancer if you have a cancer of your immune system, or it can activate and cause autoimmune problems or other problems throughout your body.
Okay. So me personally, I had implants for a decent amount of years. I got them, I think, when I was like 20. And it was mainly just to repair, like, for, I mean, it was cosmetic, but I wanted them to be like a similar size. And I didn't like the way that the shape looked. If I had a time machine, I probably wouldn't have had implants, but hindsight's 2020.
Mhm,
So, but I
mhm.
had them removed last year. So it's been a little over a year now. That it was on March 28th, 2024. The time of this recording, it's May 13th, 2025. So a little over a year. And I just came to see you for my 1 year
Yeah,
checkup.
yeah,
I'm happy with the results. They're obviously smaller than they were when I first got them. But one of the reasons that I was drawn to you is because I loved your before and after pictures. I
yeah,
had seen so many explants where I was like, wow, that after photo looks really sad. Like,
yeah,
I would be so sad to have such a difference in how things look. And I think vanity was a bit of a factor with me, choosing it
yeah.
close to me. But
Well,
so
I came into it with a reconstruction mindset. So,
right.
I wasn't just, to me, like, even I honestly at the very beginning wasn't quite sure that BII was a real thing, but I was willing to take them out en bloc because that's sort of how I did it anyway. So my focus was, how can I get you to look good afterwards? Now,
Right.
believing in BII came along later because it's obvious that patients were getting better, and I started tracking that. But at the beginning, I was really more focused on making them look good afterwards because no one else was really doing that, I felt.
Right. How much do they talk about that in the training of a breast surgeon, the BII possibility?
Oh, yeah, that doesn't exist. Yeah. So my
Wow.
training that ended in 2011, breast implant illness was never even mentioned. So, yeah,
That's
you have to
wild.
remember that breast implant illness was not originated by plastic surgeons. It was actually originated by patients who felt sick. So this, and I'm not even. It's not even really a official medical illness yet. It doesn't have, ICD-9 or ICD-10 codes for it. You can't find it. Yeah.
Interesting. So like, in your experience, like, in terms of breast implant illness, I mean, is there evidence that's coming out yet? Or is there research coming out yet? I mean, I know there's a cancer that's associated with a particular type of implant, but what do we know? Is it anecdotal at this point?
There is some new science, but at the most basic level, we know that we're sticking something foreign in our body, right? And our body's used to that. Our body has an immune system to protect us from foreign things. Now that
Mhm.
can be a big glass of whole milk, right? And that could be
Right.
foreign, and our immune system can react to that in our gut. It could be,
Mhm.
going outside and inhaling the spring air and getting pollen into our immune system, or getting coughed on in the elevator and getting exposed to the COVID virus. All these things are activating our immune system, and our immune system is used to that and evolved to fight that. Right? Like, you're going to clear
Mhm.
the milk, you're going to digest the milk, you're going to get that out. Pollen, you have mucus, you're going to clear that out. You're going to fight the virus, and you're going to eventually get immunity to it. But we don't have a system to fight this ball of silicone that's now been placed into our body, and it's not inert. We used to think that they were inert and that we could stick that in and it wasn't going to do anything. But now we know that, with this new evidence, that the shells are breaking down, whether be it silicone or saline, and that the shells are bleeding the silicone through the body. And our immune system doesn't know what to do with silicone. So we get what's called silicone granulomas, which are just chronic inflammation. And so our
Mm.
immune system is just chronically turned on trying to deal with this silicone, and it can never win that battle. It loses. It can't get rid of the silicone.
Mhm. Do you think there are some ladies who there's no reaction whatsoever? Do you think there's always some sort of reaction, even if it's just a real low grade activity?
Right. So I may have never been into to go remove a breast implant and not seen a capsule. And so a capsule is a result of your immune system turning on and creating a protective layer against this foreign object. So
Wow.
so yes, everyone's immune system turns on. Now, there's lots of people who will say, I don't feel sick at all. I got my implants, I felt fine all this time. And that's probably true. I do see a lot of patients, though, that will say, I don't have breast implant illness symptoms, and I'll take out their implants and do it right, do it en bloc, or do it total capsulectomy, remove all the capsule. And they'll come back and say, oh, I didn't even realize this symptom. I just noticed that my eyes were clear, or I just noticed I have a lot more energy after removing the implant, or a lot of other things. So to answer your question, I think that it does affect everyone, and everyone's
Yeah.
immune system is affected.
Yeah, I don't think you can realize how good you can feel, especially if it's a gradual change that's not a big overnight
Yeah.
change after getting an implant. Do you think this applies to saline as well? I'm sure there's ladies going, "Well, I have saline, so
Yeah.
silicone's not a thing for me."
Well, I used to think that. I used to think, oh, how is it really a problem with saline? But yeah, this new article, sort of Pluvy et al. They showed that the silicone is breaking down on the the shell of the saline implant. That shell is still breaking down, and that they're finding those silicone particles in the capsule, which is where your immune cells are, and your immune cells are being activated by those silicone particles.
Yeah.
And then those immune cells are then going on to to have systemic effects, to turn on systemic pathways that can affect your whole body.
Mhm. What, are there any risks or long-term complications that patients might not be told about when they're first getting implants initially? Like, we understand, kind of this activity that's happening, but in your experience, what are, like, symptoms that can oftentimes show up for ladies who are reacting to their implants? Maybe they're
I
not
mean, the
ready for
list is
that.
long. Yeah,
Yeah,
the list is long. One of the problems is that long list, which I've seen lists as many as 50 symptoms. Um, those symptoms could be caused by other things,
sure.
right? They could be sick by milk that they're drinking, or right, these things that we talked about, viruses or pollen in the air, or other things can cause these symptoms, or just autoimmune set off by something else, right? You can get a bacterial infection, and then your immune system will then, attack your own cells. So you can get autoimmune problems. But implants can cause all those problems as well. So it's hard
Mhm.
to know what the cause is, and that list is really long, and
Right,
it's really your whole immune system. There's all these things that can activate your immune system, and then there's all these things that your immune system can do. Your immune system is
right.
designed to protect you, but it can also kill you, if you
Mhm.
have autoimmune problems.
Yeah, and it's not like your immune system is a standalone system that's not connected with other things, right? Like your
Right.
endocrine, so your hormones
Right.
and your
Right.
neurological and all of that. And for me, I think it was also multifactorial. I think it was not just the implants because when I had my implants taken out, after the first few days of recovery, I felt a big difference. I
Yeah.
noticed my anxiety was a lot less specifically. I had less puffiness. I posted a picture on my Instagram of my face before and
Mm-hmm.
after, and it was less puffy and I felt less achy.
Mm-hmm.
I did end up taking some antibiotics because I had an infection in one of the breasts, and I felt like that made some of the symptoms come back. So there's obviously more to it, and the gut is a big component of our immune system, as we
Mm-hmm.
know. So, but what I will say is, I'm 44. I'm 6 months pregnant. I do
Mm-hmm.
believe that that was a
Yeah.
factor. I really do. Do you
Yeah.
see that with your patients with fertility?
Yeah, I think I have about 6 patients that really had years of infertility problems, and then got their implants removed. And then I think all of them within a year ended up having at least one or two children afterwards. And
Yeah.
that makes sense. If you think evolutionarily, the the implant is causing stress, immune stress. And if your immune system is stressed, if you're sick, you don't want to be having a baby at that point, right?
Mm.
So evolutionarily, it makes sense that you need to remove the stress. You need to have food, you need to have shelter and less stress, so that you can then have a baby. So we know that stress increases cortisol level, which then messes up your hypothalamic pituitary gonadal axis, right? And so it can mess up your hormones. It can mess up getting pregnant. It can mess up implantation if you're ready to be pregnant, and it can mess up prolongation, maintenance of your pregnancy. So
Right.
stress
Exactly.
messes up all those things, and
Right.
and immune stress is still a stress on your body.
Yeah, yeah, exactly. So if you have that chronic inflammation, even if you get pregnant, you could potentially have a higher miscarriage risk.
Yeah,
So
right.
that makes sense. Do you think that implants can interfere with mammograms or cancer detection?
Implants, yeah, just structurally, the implant pushes the breast tissue out of the way and makes some areas harder to see.
Hmm.
Um, they've found ways to get around that with ultrasounds and MRIs. With an MRI, you can really see everything, but with a
Hmm.
straight mammogram, yeah, it does. It's not as ideal.
Yeah.
Mhm.
For me, when I had implants, I had to request the MRI and the ultrasounds because my doctor just wanted to do a mammogram and just kind of squeeze the implant. I'm like,
Yeah,
does
right.
not sound
Right.
very comfortable for one, but also that created rupture for a friend of mine.
Yeah.
She
Yeah.
had a silicone implant, but it created this rupture and she got so sick after her
Yeah.
mammogram was able to go back and pinpoint that that's what you know, the actual event was that did that. So, can you walk us through what an explant surgery typically involves? So, including the difference between the total and the end block
Yeah.
capsulectomy?
Yeah. So they did change the naming of this.
Okay,
Although it was sort of a political thing at the in our society, and I'm not sure if it's even was done by people who actually do en bloc. So en bloc really it just means it in one piece. It's a French word, in one piece. And we
mhm,
do use en bloc as a cancer term, meaning like we're going to get the cancer and then we're going to get the surrounding tissue en bloc. But
got
we
it.
some of us just use that term to say we're going to get the implant and all of the scar tissue, the capsule around it, and any foreign mesh that's in there, any sutures that are not absorbable, any leaky silicone that's now sort of formed a granuloma. We're going to try and get all that in one piece. So that's our goal. And also we want that capsule to be intact so that silicone's not leaking out into the tissues. And then what's the point? We're leaving silicone in the body. So that's
Right.
why we like the idea of en bloc. So I still like to use that. The official terminology now is if you take all of the capsule and you get all that out, then you're doing a total capsulectomy. But that
Got
doesn't mean
it.
you did it in one piece. You could take it out in a bunch of pieces with silicone leaked all over in there and wash it out and call that a total capsulectomy. So I still
Mm,
like the word en bloc for what it represents, but the new terminology is total capsulectomy to remove all the
mhm.
capsule. But unfortunately, the board answer now, because I just took some questions, the board answer is you can leave capsule in your body, which is unfortunate because we now know from this evidence that there's silicone in that capsule, that there's activated immune cells in that capsule. And so if you don't get it out, you're still going to feel sick. It's sort of like, draining an abscess, but leaving some of the bacteria in there. You're still gonna feel sick if you don't get all that bacteria out of there.
Right.
The other thing that was really interesting, I had a patient just yesterday who is a what do they call that? A respiratory, not respiratory therapist, but they specialize in breathing, right?
Mhm.
And she had her en bloc capsulectomy that I did, and she said that the difference in the way that she breathed afterwards, and I knew this, but I didn't really think about it as much, that there's a big patch of scar tissue that's holding your ribs down and holding your intercostal muscles together, and you really can't take that deep breath and open up that rib cage if you have a bunch of scar tissue there. So it's one more benefit that I think is pretty cool, that if you do take that capsule off of your chest wall, which is a lot of surgeons who don't like en bloc will leave that capsule on the chest wall. There's one more benefit. You can breathe better and you have less pain, and you're not leaving a source of inflammation.
Oh my gosh, I'm nodding profusely
Yeah.
because I felt the exact same way, and I just remember before, I had no idea that that was connected for me, but I remember not being able to get a deep breath unless I would yawn
Yeah.
before
Yeah.
having my surgery, and then right after, I would take full deep breaths, and it was such a good feeling, and, just imagine how much more oxygen I'm getting
Yeah.
delivered to my tissues, which helps
Right. Right.
everything in my body work better, but
Right.
that was a huge change that I noticed that was such a cool feeling, and also
Yeah.
hugging someone, it felt different hugging.
Yeah.
It was
Right.
like
Right.
chest to chest, there wasn't
Exactly.
nothing blocking a
Heart
hug.
heart to heart. Yeah.
Yeah, heart to
Uh-huh.
heart. So why would someone want to leave the capsule? Is it that it's cheaper for the patient, or does the doctor not want to do it because it's easier to leave the capsule?
I mean, I can't speak for other surgeons, but it is more work. It does take a commitment to get all that capsule off, and it is a little more risky because there's your ribs, and then in between your ribs is this layer, these three muscle layers that connect a rib to a rib, and then right below that is your lungs. So if you're not careful and you go into that space, you can end up with a pneumothorax, which means you got a connection into your lung.
Wow.
But the anatomy, if you go slow, the anatomy is pretty clear, and the layer that you need to be in is pretty clear. And so as
Mhm.
long as you take your time and you know what you're doing and you know where you are, I think it's really safe. I mean, I've done, close to 2,000 implants where I've removed them
Wow,
en bloc and removed that capsule off the ribs.
that's
And
crazy.
it's safe. I haven't had I'm not getting pneumothoraces. I go through there and just make sure that I do it safely. Now, there
Yeah.
are some times when it isn't safe, and it's pretty rare. It's been about, I would say, maybe one in 1,000 that I've done have really been where the and usually it's really skinny girls, women who with big implants where the implants actually push the ribs apart, and then you can see the lung through the muscle. And when the muscle layer is that thin, you shouldn't be taking the capsule off. But that's
Oh,
really rare. But
yeah.
you do have to be careful. But I think for most explants, it's pretty straightforward. You just take the
Hmm.
capsule off the ribs, take the capsule off the muscle, and then you can get all that out there and feel good that all that all that silicone that's causing immune reactivity is gone.
Right. Otherwise, you would know if there's still issues after if it's from
Yeah,
that. Do
right.
do doctors charge less for keeping the capsule in?
I don't know. I
Okay.
don't know. I mean, I know it's easier because it's just
Right, of
less work.
course.
Yeah. And most of us learned, implant removal was just cut it open, pull the implant out. It was never to take that capsule. But now that
Hmm.
we know that there's silicone in that capsule, it really, to me, I feel pretty strongly that you really should be removing that capsule.
Yeah, I agree with that totally. I'm glad that I did too. So, when a woman's looking for an explant surgeon, what do you think they should be looking for? I know we're both fans of Candace, who
Yeah.
was recently on the show.
Yeah.
She
Yeah.
wrote the book, The Explant Book, so
Yeah. Yeah.
great resource. But what
Yeah,
do you
she has
think?
a lot. She has a full list of all those questions. But I mean, I think the biggest thing is you just need someone who believes in breast implantitis and believes that you need to remove that capsule in order for you to feel better. And then I think the next steps there's next steps beyond that. Next level is to make sure you fix the muscle, because if you leave the muscle attached to the breast tissue, then you get this jumpy breast phenomenon. So it's really
Oh,
important to,
interesting.
to fix the muscle. And then it's just how good can we make you look afterwards. And we really only have two tools. We have the lift and we have the fat grafting, but both of those tools can really get you looking good after an explant. You don't have to be National Geographic deflated breasts
Right.
after you remove your implant. You can have the no implant mommy makeover, and you can get them lifted and fat grafted and really really looking nice after your explant. You don't have to suffer and looking terrible. I mean,
Right.
most of my patients are really happy with the way they look after this.
Yeah, I'm pretty happy. My lift is, I don't even think you can tell that much at this point. And I did follow a lot of, Candace's recommendations on preventing a lot of the scar tissue and helping with the healing. So we'll put a link for that episode in the show notes for this too, if you guys want to continue learning about it. In terms of fat grafting, do you think that's a good thing to do initially, or do you think it's good to wait on it to kind of see how the healing goes? Like, what's your opinion
Mhm.
on that?
Yeah, I mean, I'm a big fan of fat grafting. And my happiest patients are patients that like don't need a lift, that we can just take out the implant and block, and we remove it. These are patients that really didn't need much of an implant. You can remove that relatively small implant, 250 cc implant, if you can fat graft 300 cc's of fat right at the same time, and that she comes out of surgery with the same scar, but now with she's transformed an implant, which is a source of inflammation, to like her own tissue in one surgery. They are my happiest patients.
Yeah.
And so I'm a big believer, because you're asleep. It's more surgery, it's more cost, it's more trauma to your body. Um, but if you'll survive, and you'll probably thrive, and you'll probably be so happy. A lot of patients who don't do their reconstruction at the time of their explant, they have to spend a certain amount of time being unhappy with their body, not happy with their deflated breasts, not happy with the
Right.
shape if they don't do the lift, not happy with the size if they don't do the fat grafting. And so, I think I was one of the first ones. That's really how I became famous in this, is that my first explant patient, I did the whole thing. I took out her implant, I fixed her muscle, I did the lift, and I did all the fat grafting. And that's what I would do in a breast cancer case, do all those things to make everything whole and to look really nice in one surgery.
Yeah.
And I just think there wasn't really anyone else doing that. So it's sort of a new concept to do it all at one time. But those are my happiest patients,
Yeah.
hands
Yeah.
down. Mhm.
And you could do more fat grafting later if you want,
And
right? It's not
yeah,
like a one and
yeah, I'm
done
not,
thing.
I don't ever push it. Yeah, you can always do fat grafting later. Mhm.
Mhm.
But those of you that do it at the same time as surgery, I'd say 95% of them are done, which is nice. The
Right.
other ones that don't do it, the ones that don't do fat grafting at the time of surgery, I think they have more decisions to make. They have more surgery to do. They have more
Right.
stress, I think, and it just prolongs their healing process. So we
Right.
love here. We love. I know Candace doesn't love doing it all at one time. But here we love doing it all at one time, and we love doing fat grafting at the time of the explant because we get those are our happiest patients, like I said.
I have no idea how much of the fat I retain. It's hard to say, but
Yeah,
again, I'm pregnant. I'm gonna hopefully be
yeah,
breastfeeding, and who knows what they're gonna look like in a year.
yeah.
So I'll probably be coming to see you for some more grafting at
Yeah,
that time.
that's always the big question, how much was retained? And the problem is that any answer that we give you is a made up answer because we don't have the measuring stick in order to measure, what percentage was retained.
Right,
So
exactly.
until we come up with that, we don't really know. We just have to sort of,
Mhm.
I know that some of that fat was retained, and I know that you would have been smaller and lumpier and more deflated had you not had the fat grafting. And we know
Mhm.
that because when we do the delayed, when we do it at a later time, you can see the beginning and the end, and so we know that that fat grafting works.
And where do you get the fat from?
Wherever you want me to take it from.
Mhm.
I'm a 360 guy. I think of things as cylinders, not zones, which is how we used to think of fat grafting or used to think of liposuction. So I like doing all the way around your trunk or all the way
Mhm.
around your thighs or both.
Mhm. Okay. I love it. Um, and in terms of like changes that you've seen with patients health wise, I think you had said that like a solid 50%, huge difference, right? And
Yeah,
then for the other
yeah.
ladies, it kind of varies in the degree of improvement.
Yeah, yeah. We have a big survey coming out this week for all of our explant patients.
Ooh,
You
cool.
should be getting one
Okay.
pretty soon. But we're asking that question basically. We're getting as much detail as we can to really see, how many of you got a little bit better, how many of you got dramatically better. From what I've sort of collected, and it's not as scientific or rigorous, but about 50% of you have dramatic responses. Like you said, like the next day you feel a lot better. And I
Hmm.
think that's sort of the analogy of you got over your cold, right? You finally got rid of that virus, or you drained an abscess, so that's not causing that inflammation anymore. So you remove
Right.
that, and so it's when you get over a cold, you feel a lot better. When you like drain an abscess or a boil or something that's making you feel really sick, or a tonsil or something like that, you feel a
Hmm.
lot better right away. So I think that's there's that component of it, and that's at least half of you will feel dramatically better. The other half, it's a little more subtle, and when we run their BII symptoms, some things will be better and some things won't. And I think
Yeah.
that's the complexity of these BII symptom lists.
Exactly, and there could be other things, like, I know
Right,
for me, I had a big exposure to mold in the past, and then
right.
when I had my implants taken out, I mean, I was 43, so just kinda entering that perimenopausal time, so I know hormones are a big
Yeah,
factor and all
yeah.
that, so, but there's no doubt that it was a huge, like, positive step for me in my healing. What are your thoughts on like just the messaging and marketing around implants in the beauty industry today? It's a big mind game for ladies.
Yeah. I mean, I'm a believer in the free market. I just am. So, I think it's a buyer beware thing. Sometimes we have to be careful about the newest and greatest, and we don't know which of these newest and greatest is going to really be great or is really going to be a problem. So it's hard to say because we don't know. We won't know the data till years later, right? So if you have a new product on the market, you really have to buyer beware, and know that there's probably not 40 years of data, and that's sort of where we are with breast implants. We've got so much data that, yeah, if you put these in, you may get sick.
Mhm.
There's a 50% chance that at 10 years you're going to be having more surgery, getting them replaced or removed. And then it could be a source of a lot of problems. It could have set off autoimmune problems that maybe you would never have gotten. So now you have a
Mhm.
lifetime of autoimmune illnesses,
Right.
that maybe you wouldn't have gotten had you not put those implants in. So,
Mhm.
I think it's a buyer beware type of situation.
Yeah, and it's not a lot of long-term data, obviously. So we're
Yeah,
kind of just experimenting on people.
exactly,
I
exactly.
don't like being a lab rat. I don't know about
Right, right,
people
right.
listening. So, I'm sure some of the listeners are wondering just cost on this. Like maybe I've been so sick for so long, I can't think of another cost. Like I know there are options for people who can do financing and get some
Yeah.
help that way, but I doubt insurance typically covers this, right? So it's usually an out-of-pocket
Yeah,
expense.
usually you can't. I mean, every insurance company is different, but some insurance companies will pay if you have a ruptured implant or if you have like grade 4 capsular contracture. Those are two things where you can usually get an insurance company to pay or reimburse for
Okay.
that.
Yeah.
But you're right, it is, it's expensive, for me to do an explant and to do the full reconstruction, a lift and fat grafting. That's a whole day for me. So that's the only thing
Yeah.
I do for that day. So, an OR time and anesthesia and surgeon time is a whole day is pretty expensive. So unfortunately it
Hmm.
is expensive. Um, I mean, we're sort of having a special this year trying to get back to like pre-COVID, pre-inflationary
Yeah.
prices. So we did cut our explants down because I did feel like prices kept going up and we don't want to price at least people who just need to get those implants out and do it right. I'd rather
Yeah.
they come to me and pay less than go to someone else and not do it right because then you're going to end up back to me, trying to fix it and do it right. So
Yeah, yeah, exactly. I really liked that about working with you that I was like, I'm the only patient he has today. I just liked
yeah,
that it wasn't
yeah,
like get her in, get her out, let's get another
right,
person. Didn't
right,
feel like
right.
you were just trying to make a buck. Like you really believe in this and you want ladies to feel better,
Yeah,
physically,
and
but
look
also
better
like
and look
like
better.
what they are seeing exactly
Yeah.
look better too. So what do you wish every woman considering implants knew beforehand?
I just think all the potential risks, I think plastic surgeons as a whole, we try and give you the lists of risks, but even like what I found out just in the last few years when I take out these implants is that it really messes with your muscle, like your pec major muscle, which it's a beautiful muscle, right? When you look at anatomy, this big, beautiful muscle, and it gets cut and it's all destroyed afterwards. And so like no, and no one talks about that. I mean, I wouldn't have known to talk about it.
No one
And
said
no,
that to me.
yeah, right, right. And no one knows to talk about like breast implants. We didn't even, that wasn't even a word, 10 years ago. It didn't exist. And so um I think I think it's just there's so many things that we don't know. And like, I wish we could warn you that there's all these things. And I think at the end of the day, um, because I hear the same story, that, or I'll see their pictures and I'll see their before pictures and I'll think, like, you had great, beautiful breasts. Like, you didn't really need implants. And it's all the
Yeah.
time. And a lot of times the husband will be there and be like, yeah, I told her not to get, I told her not to get implants, and stuff, and so I think if I could say something, it'd just be like, just love your body the way it is. I know it's easier said than done, but sometimes when we try and fix it, the enemy of good is better, wanting to be better, and then we end up, inviting a whole slew of problems on ourselves because we can't accept what was really good. Especially if we go
Mm,
back and look at it. We're always like, oh man, I actually had really nice breasts back then.
right.
I really didn't need to mess with them. If we were
Yeah.
really honest. But I do also understand that that's hard when you're that age and when you're in that moment. We all want, we're all very judgmental of our bodies and who we are and if we're, attractive to other people. And so I get it, but I think if there's a way to just love ourselves the way we are, I know it's
Hmm.
easier said than done, but if we could all do that, then we would save ourselves a lot of heartache down the road.
Yeah, yeah. For me, I felt like I developed a different relationship with my body after in a way that I really liked. And I
Yeah.
found that with a lot of my patients who have done explants as well, is they were happier than what they expected to be after the surgery. And it made them feel like they wanted to love their body more and
Yeah.
not look for things that need to be fixed. It's just
Right. Right.
embracing their own natural shape. So
I agree. I agree.
yeah, that's a very cool, personal journey. It really is a journey emotionally as a woman before and after the surgery
Hmm.
for sure.
Hmm.
But I can't say I have had any patients who have regretted getting the surgery, both from a health standpoint and
Yeah.
also from a cosmetic.
Yeah.
So
Neither have
yeah.
I. Neither have I.
Hmm.
Mhm.
All right. Well, last question, just if there's a myth about breast implants that you hear a lot that you want to bust.
Huh, a myth. I'm not sure. Yeah, what do you anything come to your mind?
I mean, you probably touched on it a lot, just that they cause no issues for
Oh
anyone.
yeah.
Like,
Yeah, I mean that's sort of the myth. To me it was that they're inert, right? That they
right.
don't that you put them in your body like they're fine, right? They don't do anything.
Mhm.
They're not actively doing anything. They're not causing problems, right? And it's sort of a
Yeah,
different mindset. Like, how could this implant cause problems, right? But it does. It's breaking down. It's irritating your immune system, and your immune system is you. It's so integrated with every other aspect of who you are that when you're chronically irritating your immune system, you're chronically irritating your whole body. And
exactly.
and so it's nice to, when we get that out and patients just feel like less irritated, right?
Yeah. And I
Which is a
see
nice
that
place to be.
in data. I see that with patients too. It's like we're doing mycotoxin testing, which is, is mold
Yep.
connected. We
Yep.
do heavy metals, inflammatory markers, and they change after the
That's
the
yeah.
surgery. So we have the data
Yeah.
as well.
Yeah. No,
Wow.
that's cool. That's cool. We can get that data, because it's hard. It's harder to get objective data on this,
Yeah,
and
it is.
that's why it will probably be a long time. It might be 10 or 20 or 30 years before we finally, admit that breast implants are causing breast implant illness. It may
Yeah.
take us a while.
And who knows, maybe implants will be something of the past at some point where ladies are
Maybe,
like, I'm not going to
right,
do this.
right.
Look at what happened to all them. So,
Exactly right. And
yeah.
maybe like, along with leaching and bloodletting and stuff like that,
Yeah, right.
yeah, that we thought was
All the
helping
crazy
us.
things we used to do in
Yeah,
medicine. Yeah,
yeah.
we're like, what the heck? Wow. Well, this was a really informative show. I know a lot of ladies listening and they learned something new that maybe their surgeons never told them or they don't ever hear about. So I really
Hmm.
appreciate all this. So you're in Newport Beach. I know people come
Yeah,
to see you from all over the place.
yeah.
So how can people just, learn, I guess, follow what you're up to and maybe get in touch with you guys?
Yeah, we're trying to be a little more active on Instagram.
You're doing a great job.
Yeah, yeah, that's Caesar's doing a lot of that. So shout out to him on Instagram. But we are. I have shifted. I For a long time I just was working hard and like spending time with my family. But I
Yeah.
think just within the last year, I've realized that I need to do more, and I think that's what this is about, like collecting this data. And I probably
Mhm.
have to speak up on this. It's not popular because I've been to meetings, and you're not a popular person if you do what I do and you believe in breast implant illness. But it's
Exactly.
changing. It is changing, but it's slow. And I think that we defend what we do. So if most plastic surgeons put in breast implants, so most plastic surgeons don't want to hear that what they're doing
Oh,
is
yeah.
harming people, because that's the first code of being a medical doctor is first do no harm. And so I think that's why there's going to be a resistance from most plastic surgeons, because they don't want to believe that they're doing harm. And if they know that they're doing harm, they really have to stop putting in implants. And I don't know if, that's their lifestyle for some plastic surgeons. So it's not going to be easy, but I know, I just have to get the data out there because I've seen too much now, and I've worked with too many women. I've seen too many women get better that I just need to share that now. So that's
Yeah.
what we're doing over this year. Where the survey's coming out this week. We're trying to get all of our past breast implant illness patients and
Mhm.
en bloc capsulectomies to come in to an open house in a couple weeks. So so that
Oh,
we
yay.
can like talk to them, see what their outcomes were, get some post-op photos, and then get that scientific data so we can maybe write a paper and
I love it. I mean, you can't
change the
argue
world.
with empirical data, right? The
Yeah,
objective data, it's like that's not a subjective thing. And I could see you, I never thought about this. Like, I could see you really annoying a lot of breast surgeons who are like,
sure.
you're getting
Exactly.
in the way of the flow of my business, man. I mean,
Exactly.
if
Yeah.
ladies knew more about this, it's a no-brainer that there's going to be less ladies getting implants, period. And
Right.
that affects their
Exactly.
business. And
Right.
also it forces them to learn more about this and to maybe innovate a bit of what they're doing with
Yeah.
their patients. So yeah,
Yeah.
so important. Well, I greatly appreciate your time. You are a
Yes.
busy man, so thank you for being so generous with us. And
Yes. Thank you. Thank you. I had fun talking to you. You're always fun
yeah,
to talk with.
same, always. Well, enjoy your day and we will talk
Okay.
soon.
Okay.
All
Thank
right.
you. All
Bye.
right.